My name is Lexi Nolen. I'm the director of the Center to Eliminate Health Disparities at the University of Texas Medical Branch in Galveston. My background is in issues of health equity and social determinants of health. I've worked with grassroots organizations, with civil society in a number of countries. I've worked for the World Health Organization, Pan American Health Organization, currently largely focused on rebuilding Galveston in a healthy way following the devastation caused by Hurricane Ike. One of the consequences of that event was that Galveston was left with a pretty large food desert that spans across the middle of the island where we have a dense population. And we have some pretty significant economic inequities in Galveston. We have a sizable wealthy class, lots of retirees. It's a destination recreation community in many ways, but we also have a large poorer population and less of a middle class than what would be a balance in a city of this size. And it creates some interesting dynamics, one of which is that our food security issues have become front and center, especially after the storm. We are currently working to try to find some solutions to addressing the food desert. There have been a lot of projects that have sprung up locally, and in fact, some of these are very grassroots, ranging from community gardens to more institutionalized, structured efforts from the top down, such as developing ideas for how we can recruit a new grocery store to fill in some of our food desert and what the best kind of structure for that would be. This problem is going to continue to play an important role in childhood obesity in Galveston, as it does in many communities, because childhood obesity, in our view, is largely linked to food security. And when I say food security, I'm talking about malnutrition, both excess nutrition and also deficiency in nutrition. And these kinds of processes, and especially overnutrition, is exacerbated by economics that can function at the family level in terms of family poverty, which can drive food choices towards processed food or less nutritious food, which is often the cheapest food that you can get. You know, you can, even if you can't afford to go to the grocery store and buy some really great vegetables and some high quality oil to use in your cooking, like an olive oil, and some lean cuts of beef, you can at least go down to a fast food restaurant and buy the dollar burger. That's a problem at the family level. We also see the problem playing out at the neighborhood or community level, almost regardless of what level of poverty your particular family is in, because we see entire neighborhoods that have become food deserts, where access to fresh foods is really not an option for people living in that community. They actually have to go outside of their community to get food. And this fact often surprises middle and upper class families, and sometimes you actually have to show them on a map where the grocery stores are before they believe it. One of the most startling examples of this was in Detroit several years ago, where the entire city was actually designated as a food desert because there wasn't a functional grocery store within the city limits. Everyone was having to buy their food either outside of the city limits in suburbs or at convenience stores, or get their food from restaurants or other sources. And this is a real problem. And it's beginning to be recognized and talked about more explicitly across the country. There are lots of local solutions. There are beginning to be some higher level policy solutions, recognition of the problem, and designation of subsidy funding to rebuild cities with attention to addressing food deserts. And this is really critical for neighborhoods. There are also institutionally driven choices that create processes of malnutrition. When children go to school, they are given a lunch, And so the quality of the food served in schools is really critical. And it's imperative that we understand that, for instance, our state institutions really should set the standard, should set a standard that's acceptable for supporting the health of the population. It shouldn't be standards in a race to the bottom model. It should really be a standard that families would be expected to aspire to in terms of health and nutrition. We shouldn't be looking at our institutions as undermining our health. Not just schools, but what are the choices for food at the workplace? We have tremendous number of food service providers that are nationally linked, that have very efficient processes for delivering food, but it's not necessarily healthy food, it's not necessarily fresh food, because that's not what's the cheapest to provide. And so there is a real need for us as individuals, as communities, to question whether those kinds of provisions are adequate. Do they meet our standards for what we want in our communities? Or is this something that we need to have a public conversation about and say, wait, actually this is a priority for us to come together and say this isn't adequate, this isn't sufficient for the food that we are being provided in institutional settings to actually be undermining our health. And the last thing is that we really have to retrain ourselves as a nation about what the role of healthy food in our lives is. We have become very habituated for lots of reasons, including circumstances of stress and lack of time, to make the quick food choices. And that conditions us not only to continually make those choices, but to also receive the taste in our mouths in a way that we become accustomed to that flavor. There is actually kind of a process where you have to retrain your taste buds to appreciate fresh food sometimes. And this is a big problem for kids who may not necessarily have the maturity and the rational thought to say, hey, this is something that I need to do for my health. And when they are brought up on food that is high fat, high salt, and they become habituated to it, it takes a lot of effort to decondition that taste from them.